from the RA side. So this preload will decrease and the afterload will increase. As we are returning blood back to the arterial circulation, the afterload to the left ventricle will increase, and most commonly we see the cardiac stunning in a veno-arterial ECMO, whereas these effects won't be there in the veno-venous ECMO. The decrease in preload, the increase in afterload, and the cardiac stunning you won't see in the veno-venous ECMO. In the veno-arterial ECMO, it can happen, like we see in the point number 5, at times when your native lung function is poor and part of blood is still being ejected by the heart. So this desaturated blood can supply the coronaries and the cerebral circulation. So it can happen that the lower half of your body can get a well oxygenated blood, the upper half, especially the coronaries and the cerebral circulation, can get a desaturated blood in a veno-arterial ECMO. Whereas in the veno-venous ECMO, this won't happen. Since the mixing happens at the atrial level, usually the blood that circulates the coronaries and the cerebral will maintain that minimal saturation of whatever we get, 80-85% minimum. Then in the veno-arterial blood, since we drain the blood, we decrease the pulmonary blood flow, whereas in the veno-venous, the pulmonary blood flow will be normal. So these are the major differences between the veno-arterial and veno-venous ECMOs. So let us look at what are the indications and contraindications for each type of ECMO. So the indications for veno-arterial ECMO, this as we have seen, it supports both the heart and lung, and an option of ECMO, whether it is veno-arterial or veno-venous, has to be considered only if we are not able to manage or if the patient is not responding to the maximum possible medical therapy. Because this is an invasive mechanical circulatory support, this option should be used only if you are not able to achieve the satisfactory circulation in spite of your maximal medical therapy. And as we see the indications which are used, if you see the literature, there are a lot of articles and a lot of guidelines, but the indications keep expanding. As if you see 5 or 10 years back, indications for which the ECMO was not indicated, right now we are using the ECMO for those reasons. So we use a VA ECMO or an ECMO mostly like a bridge. It can be used as a bridge for some specific purposes. One is a bridge to recovery.